This is Keith Albertson of IISE. We're here at HSPI in Orlando with another conference attendee, our incoming president of the Society for Health Systems. Please introduce yourself.
Hello everyone, Tarun Mohan Lal. I am the incoming president for Society for Health Systems and work with Atrium Health Navicent and lead their project management, process improvement and analytics functions. And excited to be here in Orlando today.
How many years have you been coming to HSPI, Tarun?
So I was just doing that count this afternoon, Keith, and my first conference was in 2008. So almost more than 10 years back. Again, discounting the 2 years we couldn't really meet in person, but I was able to join virtually.
Well, we're in person for the first time in a couple of years at HSPI. What does it mean to be able to get together again and network and meet everybody face to face?
Yeah, honestly, working for healthcare and knowing that the pandemic continues to evolve, it was a challenging decision for all of us to really understand the current state and whether to have the event in person. But I'm pretty amazed with the safety protocols we were able to follow, yet enable the networking. It almost feels like I'm reconnecting with the family after 2 years. The personal relationships that were built, we are able to really regenerate ourselves and go back with so much fresh perspective around the changes that need to happen in healthcare environment. So all I can say is I'm amazed with really getting back to in-person events and hoping that we will be able to continue to do that in the coming years.
Absolutely. Well, what do you hope to learn as an attendee from the presentations and the speakers that you can take back to your organization to help you solve problems there?
Yeah, so healthcare is at a very evolving and changing over days in today's environment, right? We've come to realize that healthcare really needs to transform to the needs of the future, whether it's in implementation of digital platforms, how do we provide better community-based support for our patients. So there's a lot of new changes, transformational changes that healthcare needs to adopt. And I personally feel industrial engineers have a significant role to play in the future. As I look at the presentations here as well, all the way from industrial engineers serving in the capacity of product managers to nurses really learning the tools and to enable process changes is becoming more and more obvious. So going back to what I'm going to take away from this conference is all the changes that are happening in the landscape, how we in the healthcare environment can collaborate better with the community partners. And then also I'm really looking forward to continuing to maintain those connections with my colleagues. Every year we see a significant amount of new members attend the conference. So that's another thing I really look forward to build new connections that I can continue to foster in the coming years.
Well, it's been a challenging couple of years for healthcare in general. What sort of priorities do you think SHS can take to help support healthcare organizations going forward and certainly our members as they support those who are giving care in this difficult time?
Yeah, so I really look at this as an opportunity. I think healthcare really can use this pandemic as a way to evolve. And like I mentioned, industrial engineers and healthcare improvement professionals have a big role to play in that. SHS really went through a strategic planning activity over the course of last year, and our new strategic plan for 2025 has 3 pillars of include, connect, and transform. So under include, we really want to expand our membership landscape to be beyond just health systems. I think we are realizing that payers, all the technology professionals are going to have a significant role to play in healthcare. So we want to increase our clinician member representation, more representation from technology innovation companies, entrepreneurs, so we can really foster that multidisciplinary environment and help provide that advocacy for healthcare needs. Coming to Connect, the 2 years we were not able to have in-person events, we all realized that it was very important for us to stay connected through virtual environments, right? Whether it is through posts on social media, whether it's through asynchronous communication platforms that IISE has, or whether it is really having social hours over Zoom. And we are going to continue to enable those type of opportunities beyond the conference in 2022. There's going to be significant amount of events where members or non-members that are interested in getting involved can join in, learn from each other, and have more robust conversations to how we can move the society and healthcare forward. And then when it comes to transform, we are really going to try to move Society for Health Systems to be a society that fits the needs of all members. And there are some members and busy professionals that don't necessarily want to stay connected on an ongoing basis and just want to have micro presentations, micro webinars, or just reach out to one of our members to learn about a specific topic. So we are going to try to make some tiered approach to our membership possible. So those who want just point of information can reach out and get that. Those who want to just access information from our website, we are going to have a lot of resources made available there. But then those who want to really get involved, we are going to have a ton of voluntary opportunities. As you can imagine, I have been a very engaged member of Society for Health System over years. It has incredibly helped me in my career, and we continue to want to be allowing for that leadership pipeline and make those opportunities available. So again, I would encourage everyone out there that's working in healthcare to really consider being a part of Society for Health Systems. It's evolved from being my professional network to my family and community, and I hope you all will make the best use of this available to you as well. So I look forward to seeing you at Society for Health Systems in the future, whether it's a virtual event or in-person conference.
Well, that sounds great. We look forward to seeing how it all comes together and following the progress over the next year. We thank you for being here. It's great to have everybody together, and thanks for spending time with us.
Thank you.